one of the things that I heard from parents and other people involved in this issue after 20 years working on the issue is, they talk to their friends and neighbors and those in systems of care, and they would say, well, I don't know anything about FASD. And I thought, well, if that's what's still happening in Minnesota, what's happening around the country?
Even though we've been working away and feel like we have had really good, solid funding in Minnesota, there still is such a lack of awareness in our systems to really be able to systemically address both prevention and supporting people living with FASD.
I volunteer with No FASD Washington State. I work with the No FASD policy team, but I'm a mom to 3 individuals impacted by FASD. And I want and I need my children to have the same opportunities as everyone else in this country. And this act really starts building the scaffolding, building the support or the foundation for creating that systemic change, bringing FASD front of mind, introducing FASD education to educators in schools, making sure more of our mental health practitioners are aware of FASD, providing FASD intervention and supports and monies to states to be able to develop that infrastructure and put FASD into the systems of care that are already existing in states. It has funding for increased diagnostic capacity. There are states, if you can believe it, that don't have any FASD diagnostic clinics even. Imagine not having a way to get your child diagnosed, let alone having supports for FASD. So I really see this bill as being a very thoughtful, we were talking about this before the call, Susan is brilliant at writing policy, and she really helped curate this bill so that it is focused on supporting families. And she was very thoughtful in how she took in feedback from thought leaders around the country and parents like myself on ways that this bill could best build the foundation so that we can elevate FASD and make sure that my kids and your kids and other kids like them, again, have the same opportunity as anyone else. Recognizing that so many people that are advocating for this are themselves either parents of individuals with FASD or individuals with FASD. We wanted to make the process as easy as possible because there's not a lot of time. And so we have everything in one place. It's all on the No FASD policy website, which is www.nofaspolicycenter.org. And if you click on the FASD Respect Act, it'll take you to everything you need to do. There's 3 steps, and everything is right there, including the email addresses of who you need to send things to. So you click a button, boom, you send the email. So just trying to make it very streamlined, very simple. But if you want to get more in depth, I have never given out my phone number so often in my life. If you want to get more in depth, if you want to get more involved, or there's something that's unclear, my phone number and email address is sprinkled throughout the website because this is what I'm here for. I'm here to support the advocacy that's being done in the field. I'm not leading it, I'm supporting it. We're here to provide that support, even down to practice calls or proofreading your letters. Whatever it is you need, we're here to support you.
Even though there are some states such as Minnesota, Washington, Alaska that have a lot more policy work and programs on FASD, there's really lack of resources on this issue. There's some states that have little to none. And so the common theme is that this bill is sorely needed.
Definitely keeping in mind, this is bipartisan legislation. There is no party politics when it comes to FASD. It impacts from the most staunchly conservative to the most liberal, and everywhere in between. And this is a big bill with a relatively small price tag. We're already spending as a nation I believe it's $205 billion on FASD annually. That money's just going to the wrong places and in the wrong ways. And so this bill has it's in terms of policy, a pretty small price tag in comparison to what it can do. And what it does is it just reshifts the focus to a more FASD informed and FASD centered way. And so I think carrying that message forward is important. We need this. We need this to be able to be more responsible with our spending, but also be more responsible to the people that this is going to support. And really, again, give them that same opportunity as everybody else.
I would just echo what Jen said. It's all about respect and equity, and this bill will systemically bring FASD to light in all of our systems of care.